Joined here. Uh, Today, I just wanted to highlight some of the aspects of neurosurgical care in stroke as we deal with them day-to-day basis. Now, Dr. Suryanarayana Sharma so elegantly he has highlighted what is stroke. Basically, stroke, as all the lay people will understand, is a paralysis which happens to one side of the body or sometimes both sides as well. Patient may be conscious or he may become unconscious. Now, a lot of these stroke patients will have early warning symptoms. Oftentimes in the society, even if it comes to our own, many of the doctors themselves, though they know that they are possibly experiencing a stroke syndrome starting, we will tend to be in denial. We always think of something which is less innocuous, that is something which is less likely to be serious, because that is the human psychology. Sometimes in the middle of the night, a person has woken up, he has suddenly realized he is not able to lift his arm, or is trying to call his wife, but the words are not coming through. And suddenly, if the wife also wakes up, and then she also thinks that, okay, maybe he has slept in a wrong position, maybe he is confused, maybe some innocuous reason is there. This is where we miss the golden hour. If at all there is one take home message from this meet, we have to highlight the fact that chest pain, as is recognized as a symptom of heart attack, these stroke patients do not exhibit pain. So it is a painless condition. They suddenly lose speech, they suddenly become paralyzed on one side, the mouth becomes deviated to the other side. The whole importance of this is time is golden here. Now, every minute of the life, our life, in our adult life, in our childhood, from the time we are born till we die, the neurons or the brain is entirely dependent upon a continuous blood supply. We cannot interrupt its blood supply even for a few minutes without harming the brain irreversibly. So, the longer we have waited, the longer and for the more duration that we have waited to recognize the symptom at home or office or wherever it has happened, and the delay that will lead to reaching the hospital or calling for an ambulance is going to be not only costly for the patient but also for the society and the family, because this is a burden, as he rightly said, 5 lakh patients with stroke who might have had the stroke 1 year back, 2 years back, 6 months back, 5 years back. Now they are living with the same burden. Also, not only the breadwinner of the family is often affected, the rest of the family is also affected, because they are going to be unable to go out and work, because someone has to be with the patient 24 by 7. So the importance is in recognizing it early. About 1 in 5 strokes will come with what we call as hemorrhage. Hemorrhage andre patient has a bleeding in the brain. The rest of the 4 of them have actually come with lack of blood supply, but here it is because of an excess bleeding in the brain. Now this, the most common again, is a silent killer called hypertension. Just to give an illustration, we had about 2 months back, we had a young boy, just an 18-year-old boy. He had gone to donate blood in his college. There was a camp, blood donation camp. They saw his blood pressure, it was very high. 18-year-old boy, his blood pressure was 180 by 120. They refused to take his blood because you cannot draw blood from a patient who is hypertensive. Till then, he was completely asymptomatic. They told him to please go meet a doctor. Not only did he not meet a doctor, he went home, he told his parents, but the parents also did not give too much importance to that, because they thought he doesn't have any symptom. Unfortunately, the very first symptom you get in hypertension is a catastrophic brain bleeding or a catastrophic MI or myocardial infarction, that is your heart attack. As it unfortunately happened in this patient, 1 month later, he had a stroke while he was asleep in the brainstem, which is the most important part of the brain, where without that active, we cannot be alive. So our heart activity, the very act of breathing, our consciousness, everything is located in this small area. In this small area, he had a massive bleed. This is an area where we cannot even help with surgery. So he was brought in a very deep coma, and in front of us, we saw him succumb. This was an entirely preventable death, because all they had to do was to have recognized that he had this hypertension, a silent killer, and someone would have started him on a medication. They would have probably seen a cardiologist like our Girish Navsundi. They would have started him on the right medication after a very simple investigation. So this is just to highlight that how sometimes we take things lightly, it will become so fatal, and the whole family will now suffer for the rest of their life. So in neurosurgical care, As soon as the patient comes with stroke, the neurologists are the ones who will handle the patient. As soon as it is recognized that there is a bleed, and this is very simple to recognize because CT scan and MRI is available everywhere. And since our hospital is a stroke pathway now certified hospital, every person in the chain knows exactly what their role is. Every nurse and every technician, not only would they know what stroke is, they know the importance of time, they know what is their role, they know whom to be called. When they come, they know exactly what they have to do. So whenever they announce a stroke code or an MI code, the entire team in which this has to happen in a very seamless way, it has to happen, and it has to happen in a very time bound manner. You might ask that there are hundreds of hospitals in Bangalore and Karnataka. Many hospitals are corporate, 5-star, 7-star hospitals are there. Is it not possible to treat this stroke and heart attack patients? Oh, it's very much possible to treat it, and it is happening all the day. Even as we speak, treatment will be going on in all these hospitals. But the key differentiator for any hospital for its excellence is when an international body certifies it, saying that not only are the people who are managing these complex patients are completely trained and certified, but they are also following due processes which are certified by international agencies, because they do not come up with these just out of thin air. They have gone through lakhs of patients' data, and they see what works and what doesn't work, what is important to be done in timely manner and what can be delayed, etc. Only when they study the data that we have given them for the last 6 months, 1 year, etc., every single patient, what has happened from the time they have landed in our emergency, including the pre-hospital care, plus when they have been seen by a doctor, when did the specialist see, when did the next imaging happen. As we all know, MRI and CT scans are always busy, but how do we make way for these patients to be given priority as if they have an express pass? So this is the kind of processes they assess, and then they certify that a comprehensive team is available, all of them are very well trained, and the infrastructure is available, and the administration is fully supportive of these kind of programs because they are very expensive even to maintain. So the neurosurgical point of view comes when these patients with a massive stroke, they have already come with the stroke. Unfortunately, it is too late for the clot busting drugs to be administered because already the brain is dead. How do we know half the brain is dead? Because the CT scan and MRI says so. In these patients now, rather than function saving, importance comes to life saving. Already we have lost part of the brain, but the brain is swollen. It is building up pressure like a volcano inside the skull. And unless something is done within very quick time, this patient will succumb right in front of our eyes. So many of these patients, as soon as they come, as a team approach, our neurologists would have already informed us. Our team, as neurosurgical team, one of us would have seen the patient. We would have understood that this patient may go in for a emergency surgery anytime. We have a 24/7 operative room for neurosurgical emergencies. And therefore, since it is very well equipped, the neurosurgical and neurological ICU will monitor these patients. And if they required surgery by the time they came, they are directly from ER oftentimes taken to the emergency neurosurgical operation theater, and the operation is done. Here we open and remove a part of the skull to allow the swelling in the brain to come out rather than go inside and damage the vital parts of the brainstem, which is irreversible when the patient is facing a massive impact. Only one more condition I want to highlight. Again, this is a take-home message. If someone in your friends or in your families or yourself, you may be getting headaches from time to time. All of us who have brains, our head will get headaches time to time. But if we ever get a headache which is described by us or the person as the worst headache in their life, it should never be taken lightly. There is a condition called subarachnoid hemorrhage, which is rare, but in a society or in a city like Bangalore, we'll probably see a few thousand cases every year. So this particular condition, there is an abnormality in the brain artery. As you all know, the arteries supply the brain, the blood supply, fresh blood supply for its minute-to-minute survival. Unfortunately, a part of that wall of one particular artery may be weak. This is present since their birth, but it is not manifested. A lot of us in this room may be having this aneurysm. Condition is called aneurysm. But it won't manifest, or it will be silent until and unless there is an episode where it gives way and there is a sudden bleeding in the brain. Here it is extremely important to recognize it in a timely manner because the bleed has stopped, patient has reached the hospital. it is only a temporary stoppage. You have a bad wound, you put some pressure, there is a scab formation, you scratch it, again it will bleed. It is similar to that. A small clot has formed which has, for the time being, sealed the bleeding. So these patients, when they come to hospital, expeditiously undergo CT scan, what is known as CT angiogram. Then they go for DSA, which is again something which we use for the stroke patient. Once we recognize that there is an aneurysm, there are two ways to treat it. Expeditiously, we either operate and clip the aneurysm and stop the bleeding from ever happening and thereby curing the patient. Or there is one more technology where even without, if the patient is not fit for surgery or if it is not a clippable aneurysm, we can do what is known as coiling. That means the endovascular way, in a very minimally invasive way, a catheter is taken into the brain, right into the aneurysm, and here some coils are deposited which will prevent the aneurysm from bleeding. In both the instances, they require ICU care after the surgery or after the coiling. And most of these patients can do well, provided, number one, they came in time. Number two, the bleed was not already fatal and they didn't come in a very, very poor shape. So the importance is to recognize those factors which are modifiable or controllable by the people. So please treat patients who are hypertensives in your own families, in your own relatives, friends, etc. Don't go with some myths. Don't go with alternative medicines. Most of them don't work. Scientifically designed, beautiful drugs are available. Doctors, even MD doctors, can prescribe those medicines. So those factors which are under our control, we can control. If you don't smoke, if you don't abuse alcohol, etc., and controlling our lipids, these things are where we can control. There are other things which may not be under our control. So recognizing these, reaching hospital in time, going to the right place where there is a stroke ready program or a heart attack ready program, this will make a big difference to the patient's outcome. Thank you very much.